Welcome once again to my channel, guys. Today we are going to continue with another frequently used nursing diagnosis when writing a care plan, right? And then this nursing diagnosis can be located in the page 322 of NANDA, domain 9, coping and stress tolerance, right? And then this diagnosis include or involves anxiety, right? So let's look at what anxiety is, its defining characteristics, as well as the related factor. Let's go on. So the definition is a vague and easy feeling of discomfort or dread accompanied by an automatic response. The source is often non-specific or unknown to the individual. So this feeling of apprehension is caused by anticipation of danger. It is also an alerting sign that warns of impending danger and enables the individual to take measures to deal with this threat or that threat. So technically, anxiety is just the body's own way of adjusting in terms of danger or bringing up a defense to a threat, right? So that's what anxiety is. So to put this as a nursing diagnosis, first of all, you have to do your assessment, your observation of a client for you to know that, okay, this particular client is anxious at a particular moment. You need to know the defining characteristics. Okay, with the defining characteristics, they are very bulky. So I'm going to mention at least one or two of them while we glance through it. You actually view this on your own due to recording space. So the defining characteristics of anxiety, this is what you see in the individual to signify that there is a need for a nursing diagnosis of an anxiety related to a particular factor. So you may see these behavioral characteristics such as decrease in productivity, extraneous movement, and fidgeting, etc. So under the effective characteristic, under the defining characteristic of anxiety, you may see fear, distress, anguish, apprehensiveness, etc. as some of the following characteristics of an individual who is anxious. Under the physiological characteristics, you can see facial tension, hand tremors, etc. as some of the signs you see that someone is actually anxious at a particular point in time. Under the sympathetic characteristic, you can see that there is alteration in respiratory pattern, there is anorexia, and then breaks reflexes, etc. as well. With the parasympathetic characteristics, you can see that the person complains of abdominal pain, there is disturbed in sleep pattern and decreased heart rate, decreased blood pressure, there is diarrhea, etc. Under the cognitive characteristics, there is alteration in attention and then alteration in what? Concentration, etc. So the individual will exhibit these characteristics, a whole lot of them, to enable you to identify that, okay, this individual is actually anxious at a particular point in time, for you to come up with your diagnosis, which is the problematic aspect, which is anxiety. So now let's move on to the related factors that you can actually put together with this problem, anxiety, in order to have a complete nursing diagnosis. So let's look at the related factors. So now let's look at the related factors. So we have conflict about life goals, exposure to toxin, family history of anxiety, heredity, and then we have interpersonal contagion, interpersonal transmission, then 7, which is major changes. Actually, under the major changes, one of the cardinal factors that we normally have in the healthcare setting is health status. Normally, individuals get anxious due to their health status, especially even if you as an individual, common flu, you are cold, and then your nostrils are blocked. Going to sleep, you even feel more anxious, the fear that, oh, if I sleep, I might not have the chance to exchange gases. So you may be having this kind of fear of anxiety where like you could die in your sleep. That's a typical example right here. So health status is currently one of the related factors mostly used when using anxiety, right? You have maturation crisis, situation crisis, stresses, substance abuse, threat of death, threat to current status, unmet needs, and value conflict. So these are the factors you can relate anxiety to in your nursing diagnosis, right? So we'll move to the next step and then see how we are going to put the diagnosis anxiety with its related factor to complete the nursing diagnosis. Now, after assessment, you will now have to come up with your problem and strength, followed by your nursing diagnosis. So using the defining characteristics, you now discover the patient's problem as being what? Anxiety, right? So now your aim right now is to put it in a sentence form. So probably the situation that triggers the anxiety will be used for the patient's problem. So we have one being patient is anxious about impending surgical procedure, into bracket maybe appendectomy. So you put the surgical procedure in the brackets over there, right? Or patient is anxious about the outcome of health condition. So patient is actually in a state of respiratory distress can trigger anxiety. Because the patient will have fear that the end result might not be good, especially asthma. That's great. There are so many problems that can be derived from anxiety. After you've discovered that the patient is eliciting the signs and symptoms of anxiety we've discussed below or previously, right? So now with that, you come up with your patient strength. So one, patient strength can be patient can express state of fear and anxiety and had hope in the entire clinical team. Or you can just simply write patient can express state of fear, you are okay. Or patient can express state of anxiety, or patient actually express state of anxiety and have hope in the entire clinical team that he or she will be fine. That's very simple. So from there, you can trigger your nursing diagnosis using the key term anxiety. What is the anxiety related to? The cause. So the anxiety is the problem. So what's the cause? So you pick it from the related factors we discussed previously. So anxiety related to unknown outcome of impending surgery, into bracket appendectomy, or any other surgical procedure the patient is actually going to have in that particular state, or anxiety related to unknown outcome of health condition, especially respiratory distress can be there, or technically put the disease condition in the bracket. All right, so let's look at this care plan online I've downloaded, right? I'm going to use it as a guide to continue the presentation. So after you've developed your nursing diagnosis, you're going to put it in the tabular form where the table is already provided in the nursing care plan. So you start with your time and date where you've known or secured the patient's problem. So we put in the diagnosis we discovered earlier, anxiety related to unknown outcome of impending surgery. Then you move to the objective stroke outcome criteria, which we already know that it's supposed to be realistic and time bound as well. So this is what you have to develop on your own. So think that the person wrote patient and family because it's dealing with both patient and family being anxious. But if it's only the patient, that's why patient will be relieved of our anxiety within 16 hours as evidenced by you can come up with your own duration of time that you achieve your goal, not necessarily copying what the person have done over here. So as evidenced by one, the nurse observing that patient is relieved or patient is relaxed and ready to undergo the surgery, then patient relative or patient or relative being happy and with high hope for a positive outcome of the surgical procedure. Good. So the nursing orders are as follows. You reassure patient or relative. You introduce patient or relative to other patients who have undergone the same surgical procedure successfully. Then you educate the patient and relative about the benefit of the surgery and its complication when not done. Good. Then you allow patient and relative to express their fears, asking questions and answer them correctly. Engage patients in diversional therapy. Then the last one is to encourage the patient to express his fears and concerns. So previously I taught you how to deal with your nursing intervention. Just make it a past tense or include a little bit rationale if possible when there is time. So I'll not go through that. This table is here to guide you on how to put your own nesting intervention. You evaluate it as well so that we secure enough time. So the table is here. You can zoom it and look at how all these are placed perfectly, and you apply it when needed. All right, thank you for your time. Don't forget to subscribe, like, and share. So we meet next time.